A stroke is a serious medical event, one that can strike without warning and change a life in an instant. Often described as a brain attack, a stroke is a true emergency that demands immediate attention. It occurs when blood flow to the brain is suddenly interrupted, cutting off the vital supply of oxygen and nutrients that brain cells need to survive. This disruption can quickly lead to the death of brain cells, resulting in lasting damage, severe disability, or even death if not treated rapidly. The brain, though it makes up only about 2% of our body weight, astonishingly consumes 20% of the oxygen we breathe. This high demand makes it especially vulnerable to any interruption in blood supply. Every minute during a stroke, millions of neurons, tiny nerve cells responsible for everything from movement to memory, can be lost forever. The longer the brain is deprived of oxygen, the greater the risk of permanent loss of abilities like speech, movement, and understanding. The consequences of a stroke depend on which area of the brain is affected and how much damage occurs. Some people may experience mild weakness, while others may lose the ability to speak or walk. Conditions like high blood pressure, diabetes, and high cholesterol can silently damage blood vessels over time, setting the stage for a stroke to occur. Understanding what a stroke is and knowing the risk factors helps us recognize symptoms early and seek immediate medical intervention, which can make all the difference. The medical term cerebrovascular accident highlights the sudden and unexpected nature of strokes, emphasizing how quickly they can happen. Cerebro refers to the brain, vascular to the blood vessels that supply it, and accident to the sudden, unexpected event that disrupts normal function. Recognizing the urgency of a stroke is crucial, not just for doctors and nurses, but for everyone. Quick action can mean the difference between recovery and lifelong disability. The brain's network of blood vessels is intricate and fragile. When even a small vessel fails, the results can be catastrophic, affecting every aspect of a person's life. By learning about strokes, their warning signs, and how to respond, we can better appreciate the need for quick action and support those at risk. This knowledge empowers us to protect ourselves and our loved ones, helping to reduce the devastating impact strokes can have on families and communities. Recognizing symptoms, such as sudden weakness, trouble speaking, or facial drooping, and acting fast can minimize brain damage and improve chances of recovery. In a stroke emergency, every second truly counts. The faster help arrives, the better the outcome can be. Strokes arise when the brain's blood supply is suddenly interrupted, depriving brain cells of vital oxygen and nutrients. This disruption can happen in different ways, each with its own causes and consequences. Strokes are classified into several types, depending on what causes the blood flow to stop or become abnormal. The most common type is the ischemic stroke, which accounts for about 85% of all cases. These occur when a blood vessel supplying the brain becomes blocked, usually by a blood clot. Clots can form directly in the arteries of the brain, often due to a buildup of fatty deposits called plaques. Alternatively, clots may travel from other parts of the body, such as the heart, especially in people with irregular heart rhythms like atrial fibrillation. Hemorrhagic strokes, while less frequent, are often more severe. They result from a blood vessel in the brain rupturing and leaking blood into surrounding tissue. This bleeding increases pressure inside the skull, compressing and damaging delicate brain cells, and can quickly become life-threatening. High blood pressure is the leading risk factor for hemorrhagic strokes, as it weakens blood vessel walls over time, making them prone to rupture. Another important type is the transient ischemic attack, or TIA. Sometimes called a mini-stroke, a TIA is caused by a temporary blockage that resolves on its own. Although TIAs don't cause lasting damage, they are serious warning signs that a major stroke could happen soon if action isn't taken. Ignoring a TIA is dangerous. It's a critical opportunity to address risk factors and prevent a potentially devastating stroke. Treatment depends on the stroke type. Ischemic strokes require urgent removal of the clot, either with medication or specialized procedures. Hemorrhagic strokes, on the other hand, need immediate measures to control bleeding and reduce pressure on the brain. Rapid diagnosis using brain scans is crucial to determine the stroke type and guide the right treatment, as every minute counts. Understanding the different causes and classifications of stroke is essential for effective treatment planning and improving patient outcomes. Ultimately, the underlying cause determines the classification, which in turn guides life-saving interventions and long-term care. Stroke symptoms are sudden and alarming, appearing without warning. They can strike anyone at any time, regardless of age or health status. Recognizing these symptoms quickly can make a significant difference in the outcome. Common signs include sudden numbness or weakness, often on one side of the body. This can affect the face, arm, or leg, making it difficult to perform everyday tasks. This one-sided weakness, or hemiparesis, is a classic stroke indicator. It can be accompanied by a feeling of heaviness or complete inability to move the affected limbs. Communication difficulties, like aphasia or dysarthria, are also common. These issues can range from mild slurring of words to complete loss of the ability to speak or understand language. Sudden changes in speech or comprehension are medical emergencies. Immediate medical intervention is crucial to prevent long-term damage. Visual disturbances, such as blurred vision or hemianopia, can occur. These changes in vision can be disorienting and may affect one or both eyes. Severe headaches, especially in hemorrhagic strokes, are another sign. These headaches are often described as the worst headache of one's life and can be accompanied by nausea or vomiting. Balance and coordination problems may indicate a stroke in the cerebellum. These issues can lead to difficulty walking, dizziness, and a loss of coordination. The FAST acronym, face drooping, arm weakness, speech difficulty, time to call emergency services, helps recognize key signs. Acting fast can save lives and improve recovery chances. Recognizing these features promptly is crucial for minimizing brain damage. Early treatment can prevent further complications and improve the likelihood of a full recovery. Quick action can significantly improve outcomes. Rehabilitation and therapy play a vital role in helping stroke survivors regain their independence. Stroke symptoms require immediate medical attention. If you or someone you know exhibits these signs, do not hesitate to call emergency services. Awareness of these signs can save lives. Educating yourself and others about stroke symptoms is a crucial step in ensuring timely medical intervention. Time is critical in stroke emergencies. Every second counts, and the faster you act, the better the chances of recovery. Understanding ischemic stroke requires a look at the cellular level. It begins with a cerebral artery blockage, halting oxygen and glucose delivery. The ischemic core, where cells die, is surrounded by the salvageable penumbra. Acute treatment aims to save the penumbra by restoring blood flow quickly. The ischemic cascade, involving glutamate release and excitotoxicity, adds to damage. Excessive glutamate triggers destructive processes, expanding the ischemic core. Inflammation and cerebral edema can worsen injury. Immune cells clean up debris but can increase pressure, restricting blood flow. Understanding these processes aids in developing protective treatments. Time is critical to prevent penumbra from becoming part of the dead core. Rapid intervention can save at-risk brain tissue. Effective treatment requires understanding these complex mechanisms. Hemorrhagic stroke involves vessel rupture, not blockage. Blood spills into or around the brain, causing immediate injury. The hematoma compresses brain tissue, raising intracranial pressure. Blood outside vessels is toxic, triggering inflammation and oxidative stress. This secondary injury can last days, worsening damage. Vasospasm, a delayed complication, can cause secondary ischemic strokes. Managing vasospasm is crucial in hemorrhagic stroke care. The body gradually clears the hematoma, leaving a cavity. Neurological deficits result from initial and secondary injuries. Understanding these processes is key to effective treatment. Rapid assessment is crucial in stroke care, influencing all treatment decisions. The primary goal is to confirm a stroke and determine its type. A CT scan quickly reveals hemorrhagic strokes. Absence of blood suggests ischemic. Assessment quantifies stroke severity, guiding treatment and predicting outcomes. Standardized scales provide objective measures of impact. Ongoing assessment monitors changes and guides rehabilitation. Detailed assessments identify specific impairments for personalized therapy. A common language among the stroke team ensures coordinated care. Standardized tools turn observation into actionable data. Effective assessment optimizes patient recovery. Communication and collaboration are key in stroke management. Assessment is the foundation of evidence-based care. Standardized tools ensure consistency in stroke assessment. The NIHSS evaluates neurological deficits quickly, guiding treatment decisions. Scores predict outcomes and inform therapy choices. The Fugl-Meyer assessment provides a detailed view of motor recovery. It tracks progress and identifies specific impairments. These tools guide therapy and measure rehabilitation effectiveness. Objective scores help set realistic goals and tailor interventions. Consistent assessment ensures coordinated care. These tools are essential for optimizing recovery. They provide a roadmap for the rehabilitation journey. Technology is revolutionizing stroke assessment, offering greater precision. Robotic and sensor-based devices measure motor performance accurately. Wearable sensors provide real-world data on movement quality. Advanced neuroimaging maps functional consequences of strokes. Techniques like fMRI and DTI enhance understanding of brain activity. Virtual reality offers engaging functional assessment experiences. These tools empower clinicians with better data for personalized care. Machine learning algorithms analyze data for precise diagnoses. Technology enhances traditional assessment methods. It provides a comprehensive view of stroke impact. The future of stroke care is data-driven and personalized. Technology and clinical expertise together improve outcomes. Understanding stroke involves recognizing symptoms and cellular processes. Ischemic strokes are blockages. Hemorrhagic strokes are bleeds. Recognizing symptoms quickly is crucial for effective response. The FAST acronym helps identify key signs. Pathophysiology drives treatment development and intervention. Assessment tools guide care and track recovery. Technology enhances assessment precision and personalization. A holistic approach improves stroke outcomes. Embracing comprehensive understanding aids recovery. Knowledge empowers action and improves survival rates. If you liked it, do subscribe and share to someone who are in need.